I was diagnosed with cirrhosis. I knew that I needed to get someplace that would be able to help me. The physical appointments were pushed back due to COVID. Then one day I get a phone call that a telehealth appointment was available for Dr. Vora. Without that telehealth appointment, I wouldn't have been able to get an appointment. I am not very good with technology. I had no idea really what Zoom was or, that being as sick as I was, that I could have an appointment over a phone call, a telehealth appointment.
So Stacy, welcome. Thanks for joining me on the telemedicine call. With Stacy, it was based on her story, based on records that we had obtained from her previous hospitalizations. I could just tell on the video call itself, you don't need to be in front of somebody to know that they're sick. And she was not doing well. She was in multi-organ failure. Her kidneys were starting to show a significant injury. Her liver was severely injured as well.
I had my meeting in the morning with Dr. Vora by telehealth, said that he wanted to look into a few things and that he would give me a call back. Little did I know that call would be just a few hours later, asking me what time I could be at the hospital. I was admitted that afternoon.
Not only to manage her acute issues, but also then think about a expedited liver transplant evaluation while she was in the hospital. We didn't skip a beat at Emory. We were able to get all of her testing done in pretty record time, I would say, for somebody that sick.
It wasn't very long after that I was told that there was a liver available, and I got my liver on April 19th.
To go from sitting in her living room on a Zoom call to coming in and getting a new transplant, getting a new liver 17 days later, and then jumping back on a Zoom call to see me, that just showed me that this works. Telemedicine works, transplantation works, and our system works.
I think being able to see someone, opposed to just a phone call, made me feel better. Being able to at least see his face as we talked, I found it very easy. Nothing, was ever hard about it. Yeah, nothing was difficult. I was very comfortable with it.
At Emory Transplant, we're seeing patients from South Georgia, North Georgia, neighboring states. And so really being able to connect with patients who are otherwise going to be difficult to connect with because of their barriers and distance from us, I think is really important, because we can then start the process a lot earlier and avoid complications for them.
My experience using telehealth at Emory was everything it just fell into place and was very smooth, and everyone was very helpful. It was wonderful. Thank you doesn't even seem like a good enough word. Thank you for taking a chance on me. Thank you for that first telehealth phone call. I just appreciate you, appreciate him giving me a chance to be a mom again, be a sister, be a daughter, giving me a chance to be able to walk out of the hospital.